Autoimmune thyroiditis is a disease in which the body interprets the thyroid glands and its hormone products T3, T4 and TSH as threats, therefore producing special antibodies that target the thyroid or unregistered trademark S cells, thereby destroying it. It presents with hyperthyroidism or hypothyroidism and the presence or absence of goiters. Categories of autoimmune thyroiditis. Specialists clinically separate autoimmune thyroiditis into two categories. 1. If goiters are present, it is understood as Hashimoto or unregistered trademark S thyroiditis. 2. If the thyroid is atrophic, but does not present goiters, it is denominated atrophic thyroiditis. If the symptoms of thyroiditis appear in women after giving birth, it is attributed to such and therefore called postpartum thyroiditis. The effects of this disease are not permanent but transient. Symptoms may come and go depending on whether the patient receives treatment, and whether the treatment is effective. Signs and symptoms. The symptoms for autoimmune thyroiditis may vary depending on whether it causes hyperthyroidism or hypothyroidism. Hyperthyroidism. Hyperthyroidism can cause sweating, rapid heart rate, anxiety, tremors, fatigue, difficulty sleeping, sudden weight loss, and protruding eyes. Hyperthyroidism. Hyperthyroidism can cause weight gain, fatigue, dry skin, hair loss, intolerance to cold, and constipation. Genetics. Thyroid autoimmunity is familiar. The disease is said to be inherited as a dominant trait since it has been reported that as many as 50% of the first-degree relatives of patients with some type of autoimmune thyroiditis present thyroid antibodies in serum. Some studies have even related it to chromosome 21 because of its high correlation with patients with Down unregistered trademark S syndrome and familial Alzheimer unregistered trademark S disease. Still, this theory is doubted, since patients with Turner unregistered trademark S syndrome also present a high prevalence of autoimmune thyroiditis. High iodine consumption. Autoimmune thyroiditis has a higher prevalence in societies that have a higher intake of iodine in their diet, such as the United States and Japan. Also, the rate of lymphocytic infiltration increased in areas where the iodine intake was once low, but had been given iodine supplementation. The prevalence of positive serum tests in such areas rises to over 40% within 0.5 to 5 years. When in the presence of excess iodine, the gland is unable to avoid its inhibitory effect on the biosynthesis of thyroid hormones. This is why when a person has excess iodine in his or her diet or is administered with additional supplementation in areas where sufficient iodine has been noted, it can induce reversible hyperthyroidism. Age. It has been shown that the prevalence of positive tests for thyroid antibodies increases with age, with a frequency as high as 33% in women 70 years old or older. The mean age of prevalence in women is higher than in men by 1 year. Autoimmune thyroiditis can also affect children. Although it is very rare for children under the age of 5, it can occur, and it accounts for around 40% of the cases in adolescents with goiters. In the case of hyperthyroidism, patients over the age of 40 have more chances of developing autoimmune thyroiditis. Mechanism. Thyroid autoantibodies appear mostly with the presence of lymphocytes in the targeted organ. Lymphocytes produce antibodies targeting 3 different thyroid proteins: thyroid peroxidase antibodies, thyroglobulin antibodies, and thyroid-stimulating hormone receptor antibodies. Some patients who are healthy may be positive for more than one of these antibodies. Doctors who attend to such patients will most likely do routine follow-ups on the patient unregistered trademark S health since, even though it is highly unlikely that they will present any thyroid problems, there is still a chance that they will develop some type of dysfunction with time. Diagnosis. There are various tests that can be made depending on the symptoms the patient presents. Doctors may search for TPOAB when the patient has symptoms that suggest hyperthyroidism, or when said patient will be started on a drug therapy associated with risks of developing hyperthyroidism, such as lithium or interferon alpha. This antibody is related to Hashimoto's thyroiditis and Graves unregistered trademark S disease. They may look for TGAB whenever a thyroglobulin test is performed to see if the antibody is present and likely to interfere. It can also be ordered in regular intervals after the patient has been diagnosed with thyroid cancer, and just like TPOAB, it can be associated with Hashimoto, a unregistered trademark as thyroiditis. In the case that the patient presents symptoms for hyperthyroidism, the doctors are more likely to test for TRAB, as well as monitoring the effects of antithyroid therapy, also associated with GRAVE, unregistered trademark S disease. Types: it can refer to Hashimoto's thyroiditis, Graves' disease, postpartum thyroiditis. References